The next bone we have is the humerus, which actually fits right in the upper arm in your body. And since it's a long bone, whenever you study a long bone, you actually divide it into a proximal end, a distal end, and the shaft, right? So we have a few structures to learn in the proximal end. You can see that most likely when you talk about the side of the bone should actually fit in an anatomical position, and normal anatomical position of this bone is that the head should be facing medially and the olecranon fossa should be facing backwards. If you orient it rightly, it will fit on the right side. So for example, in this case, I have the head facing medially towards my body and the olecranon backwards. So this bone can only fit on my right side. This is not my left bone, this is my right bone. All right, going on. So here we have the proximal end, and the proximal end has the head of the humerus. This part is called the head of the humerus, and just next to the head you can see that there are some bumps or the projections on the bone. It's called the tuberosity. So this is called the greater tubercle or greater tuberosity, and the lesser tuberosity or lesser tubercle. Two different names. Different authors will tell you different names, but some books will give you as tubercle, some books will give you as tuberosity. So greater and lesser tubercle are greater and lesser tuberosities. In between them you have this little groove, it's called intertubercular groove, and that groove allows the attachment for latissimus dorsi in the deep groove there. So there is a head, the tuberosities, and then between the head and the tuberosity you see a little a sulcus around that actually forms the boundary of the neck. This is the anatomical neck of the humerus. And then of course down here where I'm pinching it now, that's the surgical neck of the humerus. The surgical neck is generally used by the surgeons if they have to remove and rather do a shoulder transplant or the humerus head transplant, and they don't really go and dissect at the anatomical neck. They rather take a saw and cut it from here and put a prosthesis and to give you a prosthetic shoulder, right? So coming again, what are the parts you need to learn at the proximal end of the humerus? It is your head of the humerus, anatomical neck, greater tubercle or greater tuberosity, lesser tuberosity, intertubercular, the sulcus, and surgical neck. Next we are going to move on to the shaft, and the shaft we have pretty much actually no major structure except that when you run your palm of the hand through the shaft, you can feel that there is little roughness on the outer lateral side where the deltoid muscle attaches. So this is the deltoid tuberosity. This whole area is rough, and that's the attachment point for deltoid muscle. So that's the deltoid tuberosity. Down below here you have the lower end of the humerus. The lower end of the humerus has mainly the articulating surface, which is a little rounded, and you can see that this is called the condyle of the humerus. The condyle of humerus can further be divided into two parts, this outer rounded part and the medial pulley-like structure. The outer rounded structure here, this structure is called the capitulum, and it articulates with the head of the radius. Here is the radius bone, and the radius bone will articulate over it like this. As you flex your elbow, the radius articulates over the capitulum. This bone we're going to study in a few minutes. And the other side, the medial side, you have another structure here that's called the trochlea, which articulates with the trochlear notch of the ulna. And see this next bone here, there are two bones in the forearm. The medial one is called the ulna. Ulna articulates over the trochlea. You can see the trochlear notch on the ulna, which is here. This is the trochlear notch. The trochlear notch articulates with the trochlea, right? And now, just to understand this further, I have to little digress to the bone called ulna. The bone ulna has a U-like structure on the tip. So you can see this says that I'm ulna. Here you can see you have two sharp projections, one at the top here and the other one here, and then there's a notch. This projection here is called coronoid process. The projection here is olecranon process. I'll repeat again, coronoid process and olecranon process, and this one here, the notch, is called the trochlear notch. So the three structures that you need to learn at this point to understand the other bone, the humerus, is the olecranon process, the trochlear notch, and the coronoid process. We'll come back to this bone again, but let's continue with the humerus. When you look at the humerus, I told you that this whole thing is condyle. This is capitulum, which articulates with the head of the radius, and that's trochlea. These two things are trochlea. It's like a pulley which articulates with the trochlear notch of the ulna. But then there is a small depression which is right above the trochlea, right there, and which can actually house, when you actually flex the elbow, you can see the coronoid process. Remember, I just told you that this part is called the coronoid process. The coronoid process of the ulna will actually fit right into that depression. You can see that it's actually fitting right into the depression. So we call this fossa here the coronoid fossa. Similarly, when you actually flex your elbow, the head of the radius will actually come and fit right there. And that fossa here above the capitulum is called the radial fossa. Right? So the coronoid fossa and radial fossa. Coronoid fossa above the trochlea, radial fossa above the capitulum. On the reverse side, now if you bring the ulna again, you can see the coronoid fossa is fitting into the process fitting into the coronoid fossa, but on the back side, the olecranon is fitting into the olecranon fossa. That actually locks the elbow joint. So the olecranon process fits into the fossa at the back, and that's called the olecranon fossa. So one more time, what are the various structures that you need to learn in the lower part of the humerus? You need to learn about the capitulum, the trochlea, the three fossas. This is called the coronoid fossa, the radial fossa, and the olecranon fossa. Two more structures. These two structures here. Since this is called a condyle, these two are called epicondyles. Since it's on the same side of the head, this will be medial epicondyle, and that will be the lateral epicondyle on this side. Medial epicondyle, lateral epicondyle. The medial epicondyle gives the attachment or the origin for all the flexor muscles of your elbow, right? As you flex your wrist, flex your digits, all the muscles that are able to do that are actually attached from your medial epicondyle. Whereas all your extensor muscles, which are actually going to extend your wrist and extend your fingers, actually originate from the lateral epicondyle. Right? So one last review of the whole bone of the humerus: the head, the anatomical neck, the greater tuberosity, the lesser tuberosity, intertubercular sulcus. Then you have the deltoid tuberosity on the shaft. On the lower end, you have the capitulum, the trochlea, and the whole thing is called the condyle. Then you have the coronoid fossa, the radial fossa, lateral epicondyle, medial epicondyle, and on the reverse side, olecranon fossa.